morning. How are you?
I'm good. How are you?
I'm okay. My name is Julie. I'm a nurse practitioner with United States University, and I'm going to be doing your exam today. Can you tell me what your name is?
Leah,
Can you tell me how old you are?
19,
Can you tell me what year it is?
2019.
Can you tell me who the president is?
Trump.
Okay. So I'm going to be recording this for my school and my professors, and it's going to be uploaded to a public website called YouTube. And I need you to have your consent. So if you can say your first name and I consent.
Leah, I consent.
Okay, we're going to go ahead and begin the exam. Right now I'm going to wash my hands, okay?
Okay.
Doing this exam, I'm going to be doing your head, your eyes, your ears, your nose, and your neck, okay?
Okay.
Anytime during the exam that you have any questions or you feel uncomfortable, please let me know.
Okay.
Okay? We're going to go ahead and start with the examination of your head. If you look forward for me. So in my examination and assessing her head, I'm going to be looking at her hair distribution. I'm going to be checking for bald spots. I'm going to be checking for scaliness or dry scalp. And just looking at hers. Hers looks nice and clean. I don't see any spots. She got a good head of hair. I'm checking for coarse or fine hair, and so far her hair it feels fine. I'm looking at the head as a whole. I'm checking the shape of the head, making sure that I don't see any disconfigurations, making sure that I don't see any asymmetry in her head. And just looking at her hair and the way it spreads on her head, everything looks okay. Next, I'm going to be palpating your scalp. And while palpating your scalp, I'm going to be checking for lesions. I'm going to be checking for lumps. I'm going to be checking for masses. If there's any tenderness, please let me know, okay?
Okay.
Have you had any trauma to your head, like any falls or bumps?
No.
Okay. So I'm going to be checking her scalp and palpating it. While I'm palpating, I'm going to also be checking for depressions. I'm checking the contour lines. She has a lot of hair, so you really have to get in there and just really, it almost like she's going to be getting a hair massage, a scalp massage. I'm checking the back of the head to make sure I don't feel any bumps. And so far her head feels, I find no lumps or lesions or anything. Doing this part also, you might want to pull back her hair because she got some bang and just look around the edges to make sure that everything looks fine. So far hers. I'm sorry about messing up your hair.
It's okay.
Next, I'm going to go from your hair to your eyes, okay? From your head to your eyes. And if you look forward for me again, I'm going to be looking at her eyes. And while I'm looking at her eyes, I'm going to be looking at her eyebrows and making sure they're nice and not thin and not scaly. I don't see any scalps or lesions on that. I'm going to be checking the contour of her eyes to make sure the alignment is good, that there's no asymmetry associated with her eyes. I'm also going to be checking to make sure that she does not have any bulging of the eyes, which is called exophthalmos. And I'm also going to be checking the eyelashes to make sure that they're not flaky and make sure they're nice. If you close your eyes for me, I can see them better. And you can really see her eyelashes with her eyes closed, that they're all nice, long, and full. Okay, you can open your eyes back up. And I'm gonna get in front of her face and make sure that her eyes line up. And they do, because many times I want to make sure that she's not having any drooping of the eyelid, which is known as ptosis. And I don't see any lesions or lumps on her eyes, so that's showing that she has a nice set of eyes right now. Next, I'm going to go ahead and assess the eyes. I'm going to use my ophthalmoscope to do this. You can use a pen light, but since I've got to do some more testing with her eyes, I'm going to go ahead and connect this up. But right now, I'm going to use I'm going to do her eye test. Tell me the smallest line that you can read.
LTFPH.
And I'm doing it with both of her eyes open at first, and now I'm going to have her to close one of her eyes. I'm going to move to the left so we can see a little bit.
LTFPH.
Okay. And then this is for her next eye.
LTFPH.
Okay. And you want to do both of those in both eyes because that way you can get a significant reading. Are you wearing any contacts?
Yes.
Okay, with your contacts, that means that your eyes are 20/20, which is normal, okay? This checks to let her know that she can see what most people see 20 feet. She can see it also with her glasses. Now I'm going to check the people using my ophthalmoscope. I'm gonna shine a light into your eyes, okay?
Okay.
If you look straight ahead. And right now I'm just gonna be observing the lens. I'm gonna be looking at the sclera. And I'm also gonna be looking at the cornea. And I'm not really gonna look at the pupils just yet. I'm just gonna do this obliquely. And they just let me look. I'm looking for cloudness and discoloration of the lens in the iris. So far everything looks good. Next, I'm going to assess the eyelids. Then I'll come back and do the other part. Okay, so what I'm going to do, I'm going to lift up your eyelids. I'm just going to be looking at the color, okay? I'm going to check the eyelids. I'm checking the conjunctiva. And then I'm checking the bottom eyelids of the conjunctiva. And then I'm going to check the sclera. I'm checking for yellowing. Making sure that hers is not yellow. And hers is nice and light on both eyes. And I do this for the camera so we can see what I'm doing. Okay. Also, I'm looking at the lacrimal glands. And I'll do that. And sometimes you can press down to make sure there's no drainage. And hers is not having any drainage. And now I'm going to finish my eye exam by checking her. I'm going to check the, I'm going to do the fundoscopy test. And what I do is I'll look into your eye. And I'm going to look to make sure all your blood vessels and your optic disc and your optic nerve is intact, okay? If you'll look ahead for me and try to keep your eyes, if you can blink through the test, it's just, I got to find my spot. And you always start on 0, and then you can adjust the dial, anybody can adjust the dial to how they want it. I'm going to come in at a 15-degree angle. I'm going to put my hand on your shoulder, okay? First, I'm going to find the red eye reflex. Then I'm going to come in. And get real close to do this. And I found the red eye reflex, and then I'm going to try to follow, the optic, I'm going to follow all behind the blood vessels. And hers is within normal limits. Usually the measurement's about 0.3, and yours is on that side. And then what we're going to do on the other side. If you notice, I'm going to change my hands, the size of my hands, so I be at the same side, that the eye that I'm on, I'm going to be at the same eye level with her. Take some practice getting to actually get it focused, because if you have never really done this. Once you find the red eye reflex, you just kind of come on in closer. And it's kind of bright in here because I got to make sure the lighting is good for the camera, but normally you do this in the dark room. And I found hers. And you can actually see the color of her optic. This is yellow and orange looking, which is normal color. Okay, good. And I didn't observe in either eye any cupping, any hemorrhages. Her eyes appear to be normal. Her optic disc and optic nerves is intact. Okay. Now we're gonna go ahead and I'm gonna do the pupil relax. I'm gonna do your pupil reflex, pupillary reflex. I'm gonna check your extraocular movements, and I'm also gonna be checking your conversion and accommodation. Okay.
Okay.
I'm gonna use my pen light for this. This is a little lighter, so it's easier to use. If you could sit up tall for me. If you need me to reposition your chair, I can.
Oh, no, I'm okay.
Okay. So I'm gonna come in, and I'm gonna just do what you call a direct light to the eye, and I'm checking to make sure that both pupils are reacting. That one pupil is reacting to that eye to direct light, and then I'm gonna check the right eye to make sure that pupil react also. And it does. Now I'm gonna do this consensual by bringing the light in. I'm gonna watch this left eye constrict, along with the same time the right eye should be constricting, and it does. And I'm gonna do this on the opposite eye to make sure, and at the same time it should constrict, and it does. Okay. Now I'm gonna do the extra ocular movements. I just want you to follow my pen with just your eyes only, okay? And her extraocular movements are intact. Now I'm going to do the conversion test. Just follow this pen all the way in. And while I'm checking the conversion test, I'm checking her eyes for constriction of the pupils when they constrict. And I'm checking to make sure that her eyes are not jumping back and forth, which is known as nystagmus, and hers did. And I'm going to ask her, did you have any double vision while doing the test? And she done. So now I'm going to go ahead and do the accommodation test. If you'll look at the wall for me, when she looks at the wall, her pupils should dilate. And they do get bigger, and when I bring the pen, okay, focus on the pen light, as she get there, she should be able to accommodate and see this, and her pupils should get smaller, which they do. Next, I'm going to do the confrontation test. This is going to check her peripheral vision, okay? So what I need you to do is cover your left eye. And what I do is I cover the same eye, and then I'll ask her to let me know when you see my fingers.
No.
Okay?
No.
Okay. Now we're going to do the right eye. Let me know when you see my finger.
No.
Okay.
No.
Okay, good. So her confrontation test is intact. Those check her peripheral vision. Okay, next what I'm going to do, I'm going to assess her anterior sinuses and her maxillary sinus. Let me know if you feel any pressure, feel any pain when you mashing this. Any pain? Okay. No pain on the anterior sinus? The frontal sinuses. Any pain? Okay. Yes, those are her frontal sinuses that we're checking, and then her maxillary sinuses. And she didn't have any pain or discomfort with me checking those. Okay, that completes the eye exam. Now we're going to go ahead and do the ear exam. Okay?
Okay.
Upon the ear exam, I'm going to have to pull your hair back a little bit. I just want to turn your head to the left for me. If you look at her ear, I'm just checking to make sure that she does not have any swelling and drainage coming out her ear. Then I come around and I do the same thing to this ear. Make sure she doesn't have any drainage or swelling coming out that ear. I'm going to get in front of her and make sure that she has her ears symmetrical. And right here, I'm going to also, I like to do this too, because a lot of times you can't really tell when somebody has a lot of hair, where their ears are. So a lot of times I'll do this to just kind of measure my hands, and they're pretty much even. Next, I'm going to do the ear tub test. The ear tub test lets us know before we go inside the ear if the ear is sore that we may not want to. We have to be careful, really careful going in. It can have an ear infection. And I'm going to pull up on the pinna. If you have any pain,
No.
then I'm going to match that on the nystagmus. Any pain?
No.
Okay. So if she didn't have any pain with her left ear, I'm going to do the same thing with the right ear. I'm going to pull up on the pinna. Any pain?
No.
Any pain?
No.
No. So she didn't have any pain, so I could go ahead and begin my ear exam. And with the ear exam, we use what we call an otoscope. And they do have different sizes of the pediatric and adults. And then somebody's ear canal is small, you kind of want to be careful how you go in. With the adult, you want to pull up and back, so that's what I'm going to do with her ear. As I go in, I'm going to be observing the ear canal until I get to, if you turn your head to the left, okay. Let me know if you get uncomfortable, okay?
Okay.
And I'm going to be assessing the ear canal to make sure I don't see any rashes, any redness, any drainage. Now I'm going to look for the eardrum and the cone of light. And I'll be looking for all the landmarks. And I do see the cone of light. And I do see the all the landmarks that's associated with the ear canal, the mallet and the upper bones. And then I'm gonna check with the left ear. And if you notice, I'm holding my otoscope like a pen, and you want to do this because it helps you protect the patient just in case they have to turn their head a certain way. And looking at her ear canal, also in this ear, in the cone of light, and the landmarks are all intact. Okay. Now we're gonna check her hearing, because even though her eardrum is intact, we still want to check the hearing, make sure that she doesn't have any hearing problems. I'm gonna start with I'm gonna do the whisper test first. So if you'll cover one ear and they're gonna whisper a 2-syllable word, let me know what you hear, okay?
Okay.
Okay.
Banana.
Okay. So she passes the whisper test. Next I'm gonna do the Weber's test. The Weber test test for bilateral hearing through vibration and sound. Good. I can't feel it. Let me know when you can't hear it again.
No.
Okay. Did you hear it in both ear or one ear?
Both.
She heard it in both ear. So now we're going to do the conduction test, the bone conduction test.
No.
Can you still hear it?
Yes.
Okay. So her bone conduction test and her air conduction test is positive in her right ear.
No. Yes.
Okay. And her bone conduction test and air conduction test is positive in her left ear. So her hearing is intact. Now I'm going to move on to assessing your nose, okay?
Okay.
Now she had told me earlier that she has some tenderness in the left nostril, so we're going to be careful when we assess that. But right now I'm just going to look at the shape of her nose. I'm checking the bridge of her nose. I'm looking at the ala, making sure that it's not red and inflamed. Also checking for drainage, any lesions that may show any disfiguration. I'm going to look at it from the front. From the front, I'm going to be checking for deviation, and I don't see any deviation in the septum here or here. Okay, now I'm going to assess inside the nares. When I'm looking at the nares, I'm going to be looking at the turbinates, and I'm also going to be looking at the mucosa. Can you tip your head back a little bit for me? And you can lift up on the nose if you need a better vision, and also always protect your patient. We're not going to go too far in because she's already tender. She is a little red in that side. And it should be nice pale pink color. She's a little bit more red than it probably should be. Now I'm gonna be really careful with this one because this is the one that she says bothers her. Okay. Her turbinates are fine, but she does have the mucosa does have a lot of redness in there, and I did see a little scab inside that nostril. So we'll keep an eye on that, make sure that it doesn't get infected. Right now I'm going to do the smell test. The smell test is cranial nerve 8. So I'm going to ask you to close your eyes and cover one nostril and tell me what you smell.
Clove oil.
She says she smelled clove oil, and this is clove oil. And then we're going to do the next nostril. Got your eyes closed? Okay. Tell me what you smell.
Coffee.
She smelled coffee. And so even though she having a problem with her her nose today, her smell is still intact. And that concludes the nose examination. Now we're gonna go ahead and go to the mouth. On the mouth, I'm gonna be looking at her lips. I'm checking for symmetry in her lips. Everything looks symmetry. I'm checking for dryness. I'm checking for lesion. I'm checking for any blistering, which I see none on her. I'm gonna have you to smile for me, please, and making sure her smile is equal, which hers is. Also, I'm gonna go ahead and check inside the mouth, and I'll be using my light to do that. While checking in her mouth, I'm going to be looking at her tongue. I'm going to be looking at her salivary gland. I'm going to be looking at her oropharynx, and I'm going to be looking at her tonsils. I'm going to be looking at her uvula, and when she says "ah," I'm going to be assessing the inside. I'm going to be looking at her teeth. I'm going to be looking at the color of her teeth. I'm going to be looking inside her cheeks to make sure she does not have any mass or lesions or growth, and also going to be doing the same thing with her tongue. Okay, if you open your mouth for me. I'm looking at the cheeks right now. Don't see any lesions. Normally, you can put gloves on and kind of feel around inside the mouth. I'm going to be looking at her gingiva. I'm going to be looking at her gums. Don't see any swelling. Also, right here, I'm going to look at the color of her teeth. Okay, open your mouth again. I'm going to be looking at her teeth to make sure she don't have any dental caries. Okay, and sometimes on the outer teeth, like you can't really see those teeth, you can take a tongue blade and move the gums back a little bit and look at those. So when I look at her tongue, I'll probably just take one more look at her teeth on the outside to make sure she doesn't have any dental caries. Right now, I'm going to look at your oropharynx, that's in the back of your throat, okay? And I'm going to get you to say "ah." Okay, well, say "ah." And what I'm checking to make sure that her tonsils are even on the both sides. They need to be at least a 0.3, which hers is. They're not swollen, they're not red. Her uvula is midline, but it does vibrate when she say "ah." And I'm going to check the tongue right now. So what I need you to do, I want you to open mouth and push the tongue blade. Okay, open mouth. Okay. Now I'm gonna look up under your tongue. So if you still hold your tongue out, let it relax a little bit. I'm checking the salivary glands, and they're intact and they're not swollen. Okay. Now, that completes the mouth test. I just want to make sure that we can move, before we go, I just want to make sure that you can move your tongue all the way around at all angles, up and down. Okay, good. Okay, so right now, that right there was cranial nerve 12. We just want to make sure that was intact. And we did the hypoglossal and the glossopharyngeal. We did both of those also. Okay, now I'm going to check your lip nodes. And your lip nodes, I'm going to check them in front of your ears, behind your ears, and I'm going to come all the way down, and I'm going to be touching down here, okay? And each step that I get, I will explain to you what I'm doing. Okay, first I'm going to check her preauricle. That's right there in front of her ears. I'm going to check that for her lip nodes there. And so far they're non-palpable. Then I'm going to do the posterior auricle. And I'm going to move to the side so you can see for the camera that I'm doing that. Then I'm going to check the tonsillar. Any tenderness when I do that? Okay, she is complaining of some tenderness on the right side. Over here. And remember, we already looked in there, but we'll just keep an eye on that. Then I'm going to check the submandibular. Then I'm going to check the submental. It's right here. And I didn't feel anything. Then I'm going to check the anterior clavicle. And I'm going to do this with one hand so you can see what I'm doing on each side. You just kind of go down like that. And then I'm going to check the post clavicle. Then I'm going to come over to this side And check, do the same thing on this side. I'm gonna check the anterior clavicle. She's ticklish, and then I'm gonna check the. And sometimes you put a little pressure just to make sure if somebody is overweight or got more meat there. Now I'm gonna check the occipital. You always want to make sure you check everywhere that a gland could go that you can actually get to, because you don't want to miss anything. And she didn't have any enlarged glands. Now I'm going to check the supraclavicle and the inferior clavicle. Okay. Then I'm going to check the SCM. Okay, if you turn your head that way, that muscle here, it's a deep one, so they say you have to go really deep to check that. Okay, I'm gonna do the same thing on that side. And after I get through checking this, I'm gonna have her to do a shoulder shrug that checks that sternal cleomastoid muscle. If you strip the shoulders for me, good. Now I want you to turn your face to my hand. Okay. Turn your face to my hand. Okay. So that muscle nerves are intact in that area. Right now, I'm going to palpate her thyroid. I'm going to check her swallowing first. You want to check the swallowing before you start to palpate, so if they have any problems, you can notice it. Any problems. And at the same time, I'm going to go ahead and check. Hold your head up for me just a tad bit. I'm checking and making sure that I can see the cartilage right there, and making sure that's not swollen and that she does not have any enlargement around the neck. Because sometimes an enlargement around the neck can mean it could be a mass, a tumor, or a goiter, and which is seen sometimes in patients. So right now I'm going to try to, if you scoot up for me. Okay. And when I was checking her, before I check her thyroid, I want her to flex her. If you flex your neck, put your neck to your head. And I'm going to check that spinal right there at her neck. These right here are spinal accessories that I'm checking, okay, if you flex back. And this right here is checking her neck. Okay, if you turn your head from side to side, like in a rolling up. Okay, can you roll around? Okay, good. Any pain when you do that?
No.
All right. So that let us know that her neck is intact, okay? Right now, I'm going to find my cricoid bone. And I'm going to have you to take a swallow in a few minutes. Okay, go ahead and take a swallow. And what I'm looking for, I'm feeling for the evenness of her swallowing, rising and falling on both sides evenly. And both of them did good. So right now, do you have any questions about your exam?
No.
Okay, I did notice that you did have a little more redness in your sinuses. Do you have problems with allergies?
Yes.
Okay, that's a sign that you do have allergies. And I also did notice that you had a little scab in that left nostril.
Mm-hmm.
We just want to make sure we don't pick at that and keep that clean, okay?
Okay.
All right, and then you did complain of some pain along the tonsillar, right there on the right side. I didn't feel anything swollen, but that doesn't mean that something, is not irritated. So we'll kind of keep an eye on that. If you start to notice any swelling or difficulty swallowing, please let someone know, okay?
Okay.
All right, thank you for letting me do your exam.
Thank you.
And we will talk in a little bit, okay?
Okay, thank you.
You're welcome.